This is update take 2. Just did a live and not sure what happened to it. My whole screen went black and it didn't save. So let's try this again. Doing this to save it for myself and just to do an update. So I'll go back a little bit. Obviously, the leg pain has gotten worse. I can't remember if this was in November or December of 2023. Could have been even January of 24, where the plastic surgeon referred me to the pain clinic already because they thought it was going to be needed. This was before we even knew that CRPS was an issue. It was something that was happening. It was shortly after I got referred to the pain clinic originally, back over a year ago, that all 3 doctors, plastic surgeon, orthopedic surgeon, and family doctor, suspected that there were signs of CRPS happening already over a year ago. So the referral was done. At that point, I was told that it could take up to 2 years to get into the pain clinic. So it was good that it was done. The referral was done pretty quick back then. August of 24, I saw the orthopedic surgeon, and since we haven't had any information on the pain clinic at that point, he thought it would be a good idea because the CRPS was quite strong at that point already. They knew it was more visible that that's what it was. He decided to put in a referral for the pain clinic at his hospital that he works out of, hoping that, things would go a little faster. That was in August of 2024. Through the whole process of waiting and being told that I have all the signs of CRPS, the only thing that I was ever told is just to continue to do physio, continue to do exercises as much as I could, continue moving the leg and do all those things, which I've been doing. And if anybody knows me, if they tell me that I need to, do as much as I possibly can, I will push myself through the pain, through everything, to do the exercises, to do what's needed, because as far as I was concerned, that was supposed to help. Pain got worse. All the things got worse. The blood flow, the changes in color in the leg, the coldness, the toes turning purple, the zapping pain. Literally, it feels like I have an alien in my leg that has razor blades for feet and has 10 to 20 arms, and each arm has a different weapon. That's kind of how it feels like. And then some of my leg, or part of my leg, feels like it's turning to stone. Another part of the leg, in the calf, feels like I have a million spiders running around in there all the time. I have pain that's constant, that just never goes away. It can come. It's bad, but it gets worse, but it never goes away. And then I have pains that come and go. And sometimes constantly, sometimes like they decide to come in. It's just all over the place. And it feels like you're losing your mind. Cause this shouldn't be happening. There shouldn't be all these different pains in different areas of the leg. Like it's insane. And sometimes you do feel like you're losing, like I said, I feel like I have an alien in my leg and I'm losing my mind. Cause how is this possible? So things have gotten worse. I saw my oncologist in November. Could have been September, October. Could have been October, November, around that time. And she doesn't like the fact that the leg was getting worse and all the things were happening. So she thought it would be a good idea to maybe get me a referral to the rehabilitation center, physio at the Cross. Maybe they would have some different ideas, maybe like just somebody else looking at it, getting a different perspective, that kind of stuff. So I got referred to the rehabilitation center at the Cross, either October, November. Got a call. My first consultation was in January. They're quite busy as well, but I got lucky and got in January for my consultation. Saw the physiotherapist, and she confirmed definitely CRPS, and it's actually explained why things have been getting worse, because CRPS, everything I've been doing up to this point has been making it worse. because I have CRPS. So for someone who didn't have CRPS and is dealing with recovery after surgery on muscles and all the leg stuff, all the things that I was doing would have been correct. But because I already had CRPS and there were signs of it a year ago already, it's been a year of doing all the wrong things, causing it to get worse, and causing CRPS to get worse. In the case like that, CRPS should be dealt with first, before any of the exercises and all the things that you need to do for your leg. That didn't happen. Things got worse. I got lucky enough that she is specializing in CRPS. So I got lucky that I'm seeing her. And she's been amazing, trying to get things done and to help. Now, my consultation was in January. My first appointment wasn't able to be starting till February because they're quite busy as well. But I did get put on the cancellation list. So I did get to see her a couple times in January. And while I saw her in January, as we had to completely revamp my entire physio thing that we were doing, everything had to be completely revamped. I can't do the exercises. Anything that causes more pain in the leg had to stop. Obviously, there's constant pain, but anything that caused more pain, definitely had to change everything. That was happening. Anything that we had to do, everything had to change. I also have apps that I'm working on, that's supposed to help with CRPS, and there's all kinds of other things. So there's things that I'm doing which seems weird because it's completely different from what I've been doing. But I started doing that after my first consultation with her. I did see her a couple times, like I said, in January. And then I had a break for 3 weeks before seeing her on February 4th. So during that time, I had all these things that I got from her to do and practice and do all those things. So that happened. When I saw her for my consultation, she did check neck care to see what was going on and did see that there was a referral in August. Couldn't find the one from earlier from the plastic surgeon at all, but she did find the one that was in from the orthopedic surgeon that was referred in August. Didn't quite jump into it, just saw that there was a referral at that time. And because we've been waiting so long and I haven't heard anything, she reached out to Calgary to see if they could help, if I could go there, because obviously there was a wait here and I wasn't getting in. So Calgary actually said that it wasn't a good idea for me to go there because it's a long-term thing and it's going to be a lot of work. So driving to Calgary all the time is not ideal. So they rejected it, but did tell the physiotherapist that anybody with CRPS should not wait any longer than 1 to 3 months to get in. Anything with CRPS gets put to the top of the list because it's that serious. And they suggested to reach out to the orthopedic surgeon, the surgeon that referred the August referral, and talk to him and make sure that CRPS is listed on there and that all that information is there, because there's no way I should be waiting this long. So she did reach out to him through Netcare, send him information through that, and then let me know that she did that, and also said that they suggested for me to call and see if I can get a hold of the surgeon and kind of give him an idea of what's going on and say the same thing. So that was in January, and I tried from January till last week to get a hold of my doctor's office, my surgeon's office, and I haven't been able to reach them. I've left a couple messages, and then what would happen is the phone would just literally ring. There would be no message, and they always have a message system. So it was really hard to get a hold of them. I haven't been able to get a hold of them till last week. Finally got through. And in the meantime, I had 3 weeks where I had all the stuff that I needed to do and work on and let the leg kind of calm down, not do any of these exercises, and kind of take it easy and see what would happen. So I had 3 weeks of that. Saw her again last Tuesday after the 3 weeks. And nothing's changed. So the pain actually was getting worse, and the tightness and the seizing up of the leg started getting worse, which makes sense because if I don't have if insufficient blood flow, insufficient oxygen in the leg, me not moving it, not doing those things is causing the leg to seize up, which is not good either. So moving it too much and causing it pain isn't good right now, and not doing anything isn't good right now either. So have to find something in between that we can do to help that, because neither is good. When I saw the physiotherapist last week, she actually got into the neck care system and got deeper into the referral that was done originally August, and we learned that the August referral was rejected, and it was the comment on there said that it was rejected due to lack of capacity. Now, we weren't sure at first what that meant, and we still actually don't have an explanation of really exactly what that means. We think it's that there's not enough room at the clinic, at the pain clinic, for any more patients right now. They're at full capacity. There's no more room to be able to take anyone, and that's why it's been rejected. And we also noticed that after she reached out to him at the beginning of January, literally a couple days later, the orthopedic surgeon resent the referral to the same clinic, and it got rejected the next day with the same information. No phone call. Nobody's been told anything. I never heard anything. The only reason that she saw that is because she dug into it in that neck care system deeper to look into what's going on. And that's how she found it. So it was rejected again. Last Thursday, I finally got a hold of the orthopedic surgeon's clinic and talked to them. And I let her know. Now, his person there at the office had a hell of a time finding this rejection, the referral, and that it was rejected and why it was rejected. She's not sure what that exactly means either, but she thinks it's the same thing we're thinking. But she had no idea. She had a hard time finding it, really had to dig into that system to try and figure out where it was. There's a letter apparently that was sent to the orthopedic surgeon. She wasn't able to find it. The physiotherapist saw that there was a letter, but obviously she can't open it because it's directly to the surgeon, so she doesn't have access to it. But his office couldn't even find it. So that's kind of disheartening, because something like a rejection like that should be an immediate notification to the doctor, to his office, so that it can be looked at, which obviously that doesn't happen with this system. It's very, you actually have to go look for it and pay attention to it. And if they're as busy as they are that they can't even call you back, like, are they even looking at this kind of stuff? Like, there's definitely a break in the system. Like, things need to be revamped that way. Anyways, because it was rejected and we saw that, the physiotherapist reached out to Calgary again. And when I actually saw her this morning. But sorry, I'm getting off track. So when I reached my orthopedic surgeon's office and we went through all of this stuff, and she finally found it and knows what's going on, and we went through the whole thing, she was reaching out to the orthopedic surgeon herself to get him to look into what's going on and see what else can be done, because something has to be done. And found out that they're on a internet phone system, and she's looking into why I couldn't get through and why it's just ringing and all that stuff. So much going on with all of this that it's insane. So today when I saw the physiotherapist, she reached out to Calgary again because of all this, what's going on, and the weight and the lack of capacity and all this stuff. So she reached out to Calgary again, and they agreed to take me temporarily. So they will start, I'm not sure when yet. She did ask how long it might be. It might be 2 to 3 weeks before I could get in. But he was going to try and fast track it as well. It's definitely not ideal to be going to Calgary, but it's something. And what will happen is we'll start in Calgary. Obviously, probably be an assessment first. And then, they might start stuff, and hopefully we'll hear from Edmonton, from the new clinic that I got referred to, because the orthopedic surgeon referred me to a new clinic. And we did see that. There was nothing written on it yet, no rejection, no anything yet, just the referral. So hopefully we'll hear something soon, and I don't have to go to Calgary, but if I do have to Calgary, we'll start there. And then once Edmonton opens up, they will transfer me back to here. Our system is broken. Our healthcare system is so broken. There's communication issues. There's obviously being able to get into different clinic issues. There's doctors that are leaving. There's doctors that are burnt out. The medical system, the medical community is getting burnt out. There's so much going on that it's unbelievable, the crap that's happening, and people have to wait. And the fact that a pain clinic can't accept you because they're at capacity. I don't even know how many pain clinics there are in Edmonton, but that's awful. Like, I don't even know how many people out there are waiting. There could be so many people that are in pain and waiting and can't get in, and they're not being notified. They're not being told that they're being rejected for this kind of thing. There's absolutely no communication. It's hard. It's a hard thing that's happening right now, and things need to change for sure. But that is what's happening right now. The physiotherapist here at the Cross is going to continue to see me and continue to work with me. And we're going to try all kinds of different things. Right now, things that we were trying are not doing anything, not working. But it's really still very early. So we're going to continue trying different things and working on different things and trying to see what happens with all of this. But she's definitely concerned because things are getting worse and continue to get worse. And she feels that it needs medical, that what we're doing is good, that we still should be doing it. But definitely this needs to go to a doctor, a pain clinic doctor, because they've got all the different things that, they can do and deal with and evaluate and start. So I'm hoping, I've got my fingers crossed, that the pain clinic here in Edmonton takes me sooner, because that will be a challenge driving to Calgary. I can't drive. I can only drive short distances because the leg goes numb and loses blood flow and all that stuff. So driving anywhere more than 10 to 15 minutes is definitely no. So to have to drive to Calgary will be a little bit of a challenge for sure. And I don't even know what's involved in that yet. I have no idea what happens there with the pain clinic and what's involved in that. So, but I'm hoping they'll call and I'll get all that information and we can decide if that's the way to go. If not, fingers crossed that this new referral goes through, that it doesn't get rejected, and that it's not a huge long wait now. Now that we know that this is happening. Crazy. It's been insane. I honestly feel like I have an alien in my leg that is throwing tantrums and trying to get out and doing all kinds of these weird things, because the things that I'm feeling in my leg make me feel like I'm going crazy, like I'm losing my mind. Pain meds weren't working. They were actually making things worse. I had so many bad side effects from them that we had to stop. The last one I was on was the strongest, and it was actually making me lose my mind. I wasn't registering. I would be looking at something and it wouldn't register what it was. It got really bad. So that was my family doctor was trying to help with, managing the pain with pain medication. But because of all the side effects and everything that was happening, we needed to stop that, because it was worse trying to deal with the pain when I was feeling like I was going to throw up, headaches, nausea, shakes, tremors, like you name it, I had it. Every side effect that you could possibly have from this stuff, I would get. I am not really good with medication anyway. I never took pain meds normally. because it never really worked. But everything we tried just wasn't working and wasn't doing anything. So we had to stop because it was worse. So it's a little easier to be able to deal with the pain when I have, you know, the flare-ups. I mean, the constant pain is there and I'm dealing with it all the time. I feel like I'm always tense. Like every muscle in my body is literally tight because I'm dealing with it all the time. But when the extras would hit, like the stuff on top of the pain, like anything that's extra, that's crazy, that's alien-like, that really is, you couldn't even explain, because there's things that happen that I don't even know how to explain. It's easier to deal with it when I'm not feeling extra sick from the pain meds. So we had to stop them. So that's kind of what's happening right now. And because all of that, the physiotherapist at the cross feels that we need medical, and we need it fast. From what I understand and from what she explains, the longer CRPS is not treated, the obviously worse it gets, but it could come to a point where it's not reversible. And that's not something we want. And hopefully she's hoping that we haven't gotten there yet. She is a little bit worried about that it's been a year of it not being treated, and of doing the opposite of what needs to be done. So she's hoping that that's not the case. And that's why we're working on all this other stuff. And she's going to keep working with me until I get to the clinic. So, and probably even if I'm in the pain clinic, she thinks that we'll still be working together to see where we can get with this. So wish me luck. Fingers crossed that Edmonton calls before Calgary, because that would be a little bit easier. This is a long-term commitment, and a lot needs to be done. So that's my story, and I'm sticking to it. Hopefully this live actually saves and I can post it. So it's in my comments or it's in my history. And hope you guys have an awesome day. Thanks.